Stephen. My number is 1383812231. Here I am going to do the head to foot assessment. My friend saw this 360 view of room. Hi Tilkit, I am Amala. I am going to do the head to foot assessment. Here before I start, I am going to provide you basic. Can you show what's your name?
Dilpreet.
Date of birth?
Is 1st of December.
Okay, your information match with medical record. Do you have any pain in your body?
Yeah, in my head.
Okay, what it feels like? Throbbing or aching?
It's throbbing.
Okay, when it starts?
Morning.
Okay, if I give the 0 to 10, what's your pain rate?
It's 2 to 3.
Okay. As per I did the pain scale PQR-ST. Here I am going to do the neurological assessment. I am going to do level of consciousness. Do you know where are you right now?
In the hospital.
What's day today?
It's the 4th of March.
Okay. Do you know the Prime Minister of Canada?
This is Justin Trudeau.
Okay. As per the answers, I can say my client is well oriented in date, time, and person. I am going to do the Perla assessment. Okay. Just I am going to shine the light on your eyes. Just focus on the wall. Don't move your head. Okay. As per the Perla assessment, her pupil is well rounded, equal, reacted to light. Here I am going to do the accommodation and just focus on the wall. When I say just look at the pen scale, wall, pen, wall, the pen. Okay. As per the test, her pupil is well accommodated for both near and far distance. Here I am going to do the 7th cranial nerve, which is the facial nerve. Could you lift up your eyebrow? Down. Close your eyes. Open your eyes. Show me your teeth. Okay. Just lift up your arm. Closed eyes. Count 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay. As per the assessment, there is no any abnormalities in 7th cranial nerve or facial droop, and the pronator drift also negative. Here I am going to do the respiratory assessment. Here I am going to do the inspection. Do you have any chest pain or difficulty in breathing? No. As per the inspection, there is no any evidence of redness, swelling, or oozing or anything. As per the inspection, in the posterior and anterior expansion and retraction of the chest wall is bilaterally symmetrical. There is no any evidence of bare chest. Here I am going to auscultate the lung sound. I am going to assess the apex of the lung, which is above the clavicle. Compare with left. I am going to assess the upper lobe of the lung. Compare with right and left. Here I am going to assess the middle lobe of the right lung. Here I am going to assess the lower lobe of the lung, which is 4th intercostal space. Here I am going to assess the 6th intercostal space, lower lobe of the lung. I am going to assess the posterior part. I am going to assess the apex of the lung, which is above the scapula. I am going to assess the upper lobe of the lung, which is between C7 to T3. Compare with both right and left. I am going to assess the lower lobe of the lung, which is T3 to T10. Compare with both right and left. With axillary tube. As per the auscultation, there is no any evidence of abnormal lung sound, which is wheezing or crackles, and respiration also non-labored. There is no any use of extra axillary muscles for breathing. Here I am going to do the cardiac assessment. Here I am going to listen the four specific place for heart pulse. Okay. Here I can feel the clavicle bone. Little bit down I can feel the first intercostal space. Little down I can feel the second intercostal space, and I am going to move towards the sternum border on the right side where the aortic valve is located. I am going to listen that one, and I am going to move across the sternum towards to the left side and the second intercostal space where is the pulmonic valve is located. I am going to listen that one. little bit down, where I can feel the third intercostal space. Little bit down, I can feel the fourth intercostal space. On the left sternal border, where the tricuspid valve is located, I am going to listen that one. Little bit down, I can feel the fifth intercostal space. On the mid clavicle line, there is where the little bit where the mitral valve is located. It's also known as apical pulse. I'm going to auscultate 30 seconds. Okay, as per the, there is no any evidence of abnormal heart sound, which is murmur, and the apical pulse rate is 82 and the rhythm is regular. And here I'm going to check the abdomen assessment. Could you lie down? When was your last bowel moment?
So morning,
Urination?
just before half an hour.
Okay, do you have any pain in your abdomen?
No.
Here I am going to do inspection. There, by looking at, there is no any evidence of wound, swelling, redness or scars. Here I am going to do the contour. The abdomen is flat, and I am going to check the symmetry at foot side of the bed. And the abdomen is bilaterally symmetrical. And here I am going to auscultate. I am going to start with right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. There is I can hear 3 to 4 bowel sounds, which is tympanic, and here I am going to palpate. There is no any pain my client has, so I am going to do clockwise, and I am going to start with right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Abdomen is soft and there is no any evidence of tenderness and moss. And okay, that is I'm going to do the extremities assessment. The extremities, I'm going to do the inspection. The inspection, there is no any evidence of wound, swelling, redness. Do you have any pain while I'm touching? No. In the lower extremity?
No.
Okay, there is no any evidence of tenderness or pitting edema, and in both upper and lower extremities. Here I am going to check your neck. The capillary refill is also less than 2 seconds, and in both upper and lower extremity less than 2 seconds. And I am going to check the skin checker. It's also intact, and there is no any evidence of pressure ulcer in both extremities. And I'm going to check the pulse rate in both extremities. I'm going to start with carotid, one at a time, bilaterally equal, and the rhythm strength is 2+, and the dorsal pedis, the strength is 1+, bilaterally equal. The posterior tibial, the strength is 1+, and bilaterally equal, and pull towards you, and pull up. Yeah. Okay. In both extremities and upper and lower extremities, strength is 5+. There is no any evidence of abnormalities. And here I am going to do the hand wash again and document the findings. Here this is the end of head to foot assessment. My friend saw the 360 degree view of my room.